Let's talk about one other area that is big in the news right now, and that is the future cost of healthcare. And I've got this article from the AP. It says, what Americans think about rising healthcare costs according to a new poll. Most adults are worried about healthcare becoming more expensive according to this new poll as they make decisions about next year's health coverage, and a government shutdown keeps future healthcare costs in limbo for millions. 6 in 10 Americans are extremely or very concerned about their healthcare costs going into next year, a worry that extends across age groups and includes people with and without health insurance. Many Americans have healthcare anxieties too. A poll found that 4 in 10 Americans are extremely or very concerned about not being able to pay for healthcare and the medications they need, not being able to access healthcare when they need it, or losing or not having insurance. They have a few closing here, but here's a graph that I want to share. The economic and healthcare issues are top of mind. So the economy is top, then healthcare, then crime, immigration, gun policy. It's slightly different depending on, depending on the different groups there. But obviously, a lot of this has to do with the shutdown. A lot of this has to do with some of the reports that are coming out about how much health insurance is going to increase next year. Ultimately, I want to come back to something that I've been talking about for a long time, which is that the best thing that you can do if you're concerned about your healthcare costs is to be healthy. Because ultimately, most of the healthcare costs, if healthcare costs are 90% chronic illness, you can massively reduce your chances of getting a chronic illness by participating in primary prevention. I think these things go so hand in hand. And you, as the practitioner, can be a custodian of that in your community by getting out into the community, talking about these changes, talk about primary prevention, talk about what it's going to take to get healthy, and showcase some of the work that you've done in your community with some of your patients.